Everybody, thank you, Dr. Robertson, for that introduction. I know I am one talk away from lunch, so I will move through our talk as quickly and efficiently as I can. I am here to talk to you about a HRSA-funded grant that we are doing at Duke. The purpose is to increase the education that nursing students in both pre-licensure and master's level students receive in geriatric care. This is our rather large team. It's an interprofessional team of individuals who are supporting the grant and working to increase the education these students are receiving. The purpose of this New Age Sim project is to provide an innovative educational bundle to help learners care for older adults who are experiencing cognitive decline. And the methods in this traineeship include enhanced didactic content, and really the fun stuff is virtual reality, hologram scenarios that these students are able to experience and then apply in a clinical experience. We are using the age-friendly health systems, the 4 M's, as our matrix in how we create some of these hologram situations. They all will have components of mentation, medication, mobility, and what matters. And that is how we create the hologram scenarios with that 4M framework underneath. So students, all of the students engage in a virtual reality experience that we focus on a VR simulation where students get to embody the patient. So they experience the stages of Alzheimer's related dementia in one certain situation, and you get to, and I can say this from actually doing the virtual reality, you experience what it's like to be that person living with that dementia. And you go through the various stages of what that person experiences in family events, in their interactions. It's quite a powerful experience, and that's what we hear from students, that it gives them a real glimpse into what it's like to be these patients and to experience dementia. There are other virtual reality experiences that we use in this program as well that give students the ability to experience other age-related changes. So macular degeneration is one of the common ones that patients or the students are able to experience. I can recall in doing that virtual reality simulation constantly looking up to try and get my center of vision. So they really do give you a perspective on what those patients may be going through. The hologram experience is a unique experience to this. We co-designed all of these scenarios with our clinical partner, and we record them using standardized patient actors. And the trainees are able to develop a competency as they work with these holograms. And my hope is that I'll get through this presentation, you'll have a chance to actually see the hologram. We utilize best practices in order to develop and to deliver these hologram simulations. And what's nice about them and what students have reflected on is that they are an unfolding case scenario. So they're able to experience what happens in the hologram, and then through the use of simulation educators, we are able to unpack what they're experiencing, and they're able to reflect on that in the experience. So our community partner in this is a senior community care. It's a PACE program. I'm sure some of you are familiar with PACE programs. They are programs for all-inclusive care for the elderly, and their hallmarks are that they are an interprofessional based care program. PACE participants are over the age of 55. They are all nursing home eligible. However, they desire to stay in their own home, and many many of these participants, if not all of them, in many of the programs are dual eligible, meaning they're Medicare and Medicaid eligible. And so all of our trainees, including pre-licensure students who are being prepared for their registered nurse licensure, and our nurse practitioner students attend a clinical experience at PACE after they have undergone and completed the training in the virtual reality and hologram experiences. And so as the grant progresses year over year, we have more students that are involved in this additional training, and then they experience their PACE clinical partnership. And so you can see that during this first year, we've had a high yield as far as outcomes are met at PACE. And we're using the SET-M tool, which is a standardized tool used in the simulation community to really assess for how well they are meeting their objectives and different confidence levels that they have. I think what's most exciting about this grant in particular is that it gets after the affective domain of teaching, meaning how these students can feel, how they demonstrate empathy for participants experiencing dementia after this training program that they have undergone. We also assess for the 4M competencies as well, so how well they were able to utilize what matters, mobility, mentation, and medication. And we're assessing their new age sim experiences as well. So I really want you to get a chance to see the hologram because the hologram is quite cool. So I'm going to invite Raymond Brisson, who's our simulation expert, technology expert, to share with you a version of the hologram so that you can kind of see what we're exposing students to. I will say that students are most of the feedback that we get from students about the experience is they wish that all of their colleagues in the programs could be a part of this and be able to participate in both the hologram and the VR simulation. So very hopeful that technology will integrate its way in there and help us to better care for these individuals.
I can take this off, right? Okay. Hi, everyone. This is our small tabletop version, which we take around to our various clinical sites. The one that we use at Duke is probably about this big and about, I think, 8 feet tall. So hopefully we tested this out earlier, so you'll be able to hear what's going on here. And we'll bring this up here. And this scenario we're going to show, and we'll keep it kind of brief because I know lunch is coming up, is a Parkinson's case.
Hi there. My name is Sam Robertson. I'm not doing so great. I've been having more trouble moving around, and I've fallen a couple of times. When I tried standing up, it's just getting harder for anyone to help me move around the house. Sorry. I'm just not sleeping much these days. There are times I feel forgetful, especially later in the day. My wife is worried about the falls. She calls it confusion. She keeps saying it might be because of my medications. I don't know. These falls scare me, both of us. I don't want to be confused. She told me you wanted to see my medications. Well, here they are.
All right. Okay, that's probably about enough for now, right now. I think, do we have time for questions, or do we need to move on?
And for one question. Mm-hmm. One question, anyone? Okay.
I'll give this to you.
Dr. Wiznicki.
Those are really interesting, and kudos for a sophisticated and modern version to the lab simulation patient. Is there any consideration about bringing actual patients? While that was well done, that professional patient doesn't actually have Parkinsonism, for example. I think these videos perhaps could be even more enhanced if you had somebody with the condition doing it.
Excellent question. When the standardized patient actors are given their script, we work with them to exhibit some of the symptoms that you see in patients who have the actual condition. It is something that we've thought about. We are currently using the standardized patients in order to provide, they're familiar with the technology, et cetera. There's been some talk of using our clinical partner agency, using some of the healthcare providers who are there to actively participate in some of the hologram scenarios as well.